Today, we're going to talk about something really important but also very sensitive, a medical condition called adult acquired buried penis, or AABP for short. Now, this condition affects a growing number of men, and so many of them are suffering in silence. So our goal here is to just shed some light on what it is, how it's treated, and really why this conversation matters so much.
And this quote from Dr. Benjamin Breyer at UCSF, wow, it just gets right to the heart of the whole issue. You know, AABP isn't just some medical term, it's a hidden struggle. But the most important thing to take away from this is that there are effective treatments out there. Help is available. So, what exactly is AABP? This definition is super important to understand. The penis itself is typically a normal size. It functions normally. The problem isn't the penis, it's the tissue around it. All this excess skin and fat that basically buries it and makes it inaccessible.
And you can imagine the sensitive nature of this condition creates this huge barrier for people. I mean, a lot of men feel embarrassed or they're just hesitant to even bring it up with a doctor. And what that means is that this problem is probably way more common than any official numbers can tell us.
Okay, so let's really dive into this hidden condition. We need to unpack what it is, and maybe just as important, what it is not.
Now, this slide is fantastic because it clears up so many common misconceptions. The real issue here is structural. We're talking about excess tissue, skin that isn't attached properly, and all the inflammation that comes with that. This has nothing to do with the size of the penis, and, this is critical, it's not something that just losing weight can fix on its own. It's an anatomical problem that needs a surgical solution to be corrected.
All right, so since we know it's a structural problem, we've got to look at the anatomy of it. Let's get a little closer and see what's actually going on physically that causes this condition.
So it usually comes down to one of three main culprits. By far the most common is morbid obesity, which can create a really large pad of fat right above the pubic area. But it can also be caused by scarring from other surgeries or a condition called genital lymphedema. And it's no surprise that as obesity rates go up, we're seeing more and more cases of AABP.
And this diagram right here, it shows you the core mechanical problem perfectly. The penis just isn't anchored down the way it should be. Because of that, it can actually telescope or retract back into all that surrounding fat and skin. It's still there, it's just hidden.
So if we want to get specific, it's this anatomical failure right here. The best way to think about it is like a tent pole that isn't staked to the ground properly. The issue is in the fascia, which is like this web of connective tissue. The outer layer of fascia just isn't holding on tight to the deeper layers, and that allows the whole structure to become unstable and retract.
But here is where the story gets really hopeful. Because this is a structural mechanical problem, there is a surgical solution. And surgeons have developed some pretty sophisticated techniques to fix it. So let's take a look. The surgical approach is really a logical three-step plan. First, the surgeons have to get rid of all that excess tissue that's causing the problem in the first place. Second, they free the penis itself, which sometimes means they need to use skin grafts to make sure there's enough coverage. And third, and this is the absolute key, they create new, secure anchor points to make sure it can't retract again. This diagram shows us that first big anchoring step. Surgeons use what are called tacking sutures. Basically, these are stitches that fasten the skin down to the tough tissue that covers your abdominal muscles. This creates a really firm foundation and stops that skin from sliding forward and over the penis.
And here's the second, equally important anchor. More of those tacking sutures are placed right at the base of the penis, and they attach the skin directly to the shaft. This is what specifically stops that telescoping action we saw earlier. It makes sure the penis stays external and doesn't slide back into the scrotum.
So, we've defined the problem, we've looked at the solution, but what does this all mean for the patient? Well, this surgery is about so much more than just cosmetics. It's about giving someone their entire quality of life back.
I mean, this slide really says it all, doesn't it? The contrast is just stark. Patients go from dealing with chronic infections, problems with urination and sex, and just incredible mental strain to getting all of that back. They regain normal function, hygiene, confidence. The improvement in their quality of life is just profound.
And this quote from a research paper really drives home the psychological transformation. It's not just a physical thing, it's emotional, it's mental. Patients often have this dramatic shift where they just become happier, more confident, and so much more optimistic about their future.
Of course, a life-changing surgery like this comes with a serious recovery. It's not easy. Patients have to be really patient and careful, following very strict rules about activity and hygiene for weeks. It's definitely a journey, but it's one with a very clear and very bright destination.
So the big takeaway here is that even though the condition is really complex, the solution is, too. It's comprehensive. A successful surgery doesn't just fix one physical issue, it gives a person back their sense of normalcy and well-being in every single part of their life.
And that kind of brings us to our final thought. This isn't just a surgical issue, it's a public health one. As AABP becomes more common, the real challenge becomes a social one. How do we break down those walls of silence and embarrassment to make sure that everyone who needs this transformative care can actually find it?